San Ramon Regional Medical Center is a primary stroke center. We have a certain protocol that is the national standard. We have served so many patients. In 2017 alone, we saw 297 stroke patients, which is a really big number for a small hospital.
So there are two types of stroke. There's hemorrhagic stroke, which refers to a disruption or rupture of a blood vessel. And the more common type of stroke is called an ischemic stroke, and that occurs when there is a blockage in the blood vessel, often a blood clot, that leads to disruption of blood flow to a specific part of the brain.
So what I like to use when I'm teaching in the community and to my patients is B-FAST, B-E-F-A-S-T. The B for balance, E for eyes, F for face, A, arms, S, speech, T, time. So really what it is the identification of the sudden onset of symptoms or abnormalities. So all of a sudden I couldn't walk straight. All of a sudden my vision got blurry, or my face, I have a facial droop. My arm, I can't move my arm, I can't feel my arm. Speech, I can't say what I want to say. Or I can't speak at all. And then T is the time, the importance of calling 911. Stroke is a sudden onset of symptoms, and with that sudden onset of symptoms, the most important thing to do is call 911 right away. The sooner we are treating our stroke patients, the better the outcome. As soon as the patient arrives, the nurses and doctors in the emergency room take action. Of course, we do vital signs on arrival. We do something called the NIHSS. It's basically how people can speak, if they can express what they want to say, if they can move, if they can read. Patients on the monitor, we're getting a quick history. Patients going to CAT scan. If the CAT scan is negative for bleed, then we would initiate TPA, which is the clot-busting drug for ischemic strokes.
The one therapy that we have is called TPA, tissue plasminogen activator. It is really the strongest blood thinning medicine we have, and it works by dissolving the clots that cause those non-bleeding strokes, which is the majority of strokes. We see 85%. The sooner we give the TPA from the onset of the stroke, the better the effect is.
It's truly a team effort from admission to discharge with our program. Our goal at San Ramon is less than 45 minutes. The national standard is less than 60 minutes. Last quarter, our average TPA time was 38.1 minutes, so we do very well here at San Ramon. We're like a well-oiled machine now.
They took remarkable care of my husband, but it always came to me as well. You know, your husband's doing fine, he's resting, what can we do for you? How can we, help? How can we make your stay here, nicer? And I felt like I was actually at some points in a 4-star resort, because they were sure I was comfortable and fed and cared for, and they were concerned about my well-being as far as being tired or stressed, and it was just a great experience.
It's such a devastating disease, not just for the patient, but their loved ones as well. And so to be able to have a significant impact on their lives and help them either reduce their disability or completely reverse it is more than rewarding for all of us.